Your kidneys play a crucial part in the overall health of your body. They aid in the removal of waste and excess fluid from the body. They also eliminate acid to keep the water, salts, and minerals in the body in a healthy equilibrium. Your neurons, muscles, and other body tissues may begin to malfunction if you don't maintain a healthy balance. As a result, it's critical to keep your kidneys in good shape. By the way, the kidneys of this channel will appreciate it if you considered liking this video and subscribing to our channel to make health go viral. With that said, let's get this video going to discover which habits will destroy your kidneys over time. Number 7. Consumption of a vitamin-deficient diet. There are particular vitamins that are beneficial to the kidneys, and it's likely that not getting enough of those vitamins could be hazardous to their health if they don't get enough of them. It has been shown that people with renal sickness do not take a sufficient quantity of vitamin D. It has also been established that supplementing with vitamin B6 in addition to other drugs is advantageous to the overall health of the kidneys. Simply exposing yourself to the sun for 10 to 15 minutes at a time is all that is required of you in order to produce the necessary amount of vitamin D for the day. Vitamin B6 can be found in high concentrations in foods such as salmon, chickpeas, potatoes, and several other starchy vegetables and vegetables that are not citrus fruits. Vitamin B6 can also be found in fruits that are not citrus. Number 6. Overuse of painkillers. You might be tempted to take medication on a daily basis in order to alleviate the throbbing pain in your head, but doing so could have adverse effects on your kidneys if you take more of the prescribed drug than is recommended. However, despite the fact that they may be useful in reducing pain, there is evidence to suggest that long-term use of these medications is linked to an increased risk of developing kidney cancer. Number 5. Inadequate water consumption. It is an imperative requirement that the fluid reserves in your body be replenished on a consistent basis. Blood is filtered and waste items are eliminated through the kidneys, which are responsible for their function. When there is a high concentration of waste in comparison to the volume of fluid that is present, there is a greater risk of developing renal stones as well as other conditions that are associated with the kidneys. The American Heart Association recommends that a total of 12 cups of water be eaten on a daily basis. Number 4. Excessive use of processed foods. You run the danger of causing damage to your kidneys if you satisfy your urge for something crunchy and tasty in the middle of the night by eating processed food. This is because processed food contains a lot of salt, sugar, and fat, all of which are known to be harmful to the kidneys. One of the contributing variables that could cause damage to the kidneys is the high levels of salt and phosphorus that are often found in processed meals. This is one of the contributing causes. Number 3. Not getting enough exercise. It is possible to considerably reduce the risk of developing kidney stones by engaging in physical activity on a regular basis, at least 3 times per week. Persons who have diminished kidney function may consider taking up walking since it can help minimize the risk of cardiovascular problems. These problems are particularly severe for people who have chronic renal illness or who are already undergoing dialysis. It is critical to engage in some form of physical activity for at least half an hour, 5 days each week. Number 2. Consuming an excessive amount of alcohol. If you are unable to overcome the habit of drinking, you put your kidneys at risk of damage if you continue to drink wine and other alcoholic beverages on a regular basis. This puts you at greater risk of getting renal failure. Your susceptibility to this risk increases in direct proportion to your chronological age. According to research, having more than 2 drinks on a daily basis or 4 drinks per week is related with a greater than 2-fold increase in the risk of developing chronic renal impairment. This association was found to exist between the 2 variables. And number 1. Excessive salt consumption. Consuming a large quantity of foods and beverages that are high in salt, sodium, might potentially be harmful to your kidneys since it raises your blood pressure. As a result of this spike, your kidneys may become damaged. Try flavoring your food using a variety of herbs and spices rather than salt. Salt is not necessary. If you do this, you will be able, over time and with continued effort, to reduce the amount of salt that is included in the foods that you eat. There you have it. What changes do you think you'll make to your diet in order to support your kidney health? Leave your answer in the comments section below. If this video was helpful, please like and subscribe so that health can go viral. I hope you enjoy this content. Stay tuned for more videos on how to improve your health. For a list of powerful home remedies, click on the links below. Eat well and prosper.